Welcome to the National Press Club Newsmakers Committee event today. I'm Joe Sparks, committee member, and today's event coordinator. The National Press Club is the world's leading organization for journalists. For more information, go to www.press.org. When an employee first joins a corporation, the question of benefits will come up. Benefits at one point consisted of set contribution with defined benefits. Now there are many different plans with many different contribution requirements. Cost is a concern for the corporations and employees. Today, corporate representatives and representatives from the American Benefits Council and Industry Trade Association will discuss their vision and strategic plan for benefits. They will discuss policy and legislative changes that will keep American businesses competitive and protect the financial and physical well-being of employees. Our speakers today are Janet Boyd, Jim Klein, Mike Kiley, Katie Spangler, and Lynn Dudley will provide information as necessary. We will have each person introduce themselves, and then the presentations will begin. There are a few ground rules before we get started. A question and answer period will follow the main speech. Questions will be from credentialed media and club members. Please identify yourself and your organization before asking your brief question. No speeches, please. I also want to thank the National Press Club Newsmakers Committee Chair, Herb Perrone, club staff Joanne Booz, the engineering staff, and our organizing team. Please join me in welcoming Janet Boyd, Jim Klein, Mike Kiley, Lynn Dudley, and Katie Spangler to the National Press Club. And
thank you, and thank you for your time today. My name is Janet Boyd. I'm the Director of Government Relations for the Dow Chemical Company, and I focus on benefits issues as well as tax issues. So this is clearly in my wheelhouse. I also serve as the chair of the ABC Policy Committee. So we are excited about this opportunity to present and explain why we developed our 2020 vision. And each of you have a copy of the report, and it's just coming out today. And feel free to follow along, by the way. I'm going to be referencing a few pages, so it might be helpful for you on that. First, I want to explain how we developed the document. As I served on the project's task force of about a dozen senior members of the council, representing a wide range of businesses, and you'll see that on page 3 of the report. But I particularly wanted to call out my colleague, Wilma Schopp of Sigma Aldrich Corporation, who led the task force's efforts to develop the vision. My subsequent efforts to help finish the project could not have been possible without her leadership. We worked for more than a year with many in-person meetings as well as many revisions and intense discussions, which led to this project, the end of the project, all of which resulted in the structure that we're going to describe today, as well as the report itself. It was approved by the ABC Policy Board and Board of Directors. The report considers drivers such as the anticipated implementation of the ACA law, as well as congressional interest in tax reform, but we don't stop there, as employers have many other policy interests that can impact their efforts to enhance their company's benefit programs. The Council's report describes 4 vision statements, which are intended to describe what we hope will be the environment for employer-sponsored benefit programs generally in 2020 and beyond. And it's kind of a funny years, you normally you would think, well, do sort of even years, maybe 10 years, 20 years or whatever. But I think most of us would agree that this is a time of great change. And so it seemed to us that we wanted to go somewhat into the future, but not too far in the future. We need to see what's going to happen as far as changes in the political environment and technology and other things. So we thought that this 2020 framework was probably the best framework to use. The vision statements can be found on page 11 of this report, and I'm going to summarize each of them for you. The first one is centered around personal health and financial well-being, and where we hope that this will be the primary objective of employer benefit plans. But this reflects our recognition today that traditional silos into which health, retirement, and other benefits have been traditionally considered are breaking down, as our focus is switching now to broader wellness programs. The second vision relates to global competitiveness and how that will dictate benefit design in the future. Quite frankly, it's already dictating a lot for companies like mine, which do have operations around the world. Among large employers, workforces are increasingly mobile. The benefit system will need to accommodate that reality, and employers will increasingly be called upon to navigate a myriad of laws that govern human resources and benefits. Our third vision is that employers will have the flexibility to pursue a range of employee benefit approaches. Flexibility has traditionally been important in our area, but it's even more so now. In the future, some employers will still subscribe to the more traditional plan sponsorship, which Dow has, while others are going to find it more appropriate to be a facilitator and therefore maybe make access to benefits without actually helping to pay for them. But this will empower employees to take a greater ownership of their benefits. The fourth relates to benefits and administration and participation will be simple and predictable. Stable tax policies that encourage employer sponsorship and protection of the federal ERISA framework are necessary for employers to have a predictable system and avoid unnecessary complexity. So those are our four visions. In order to actually effectuate those visions, we also spent quite a bit of time developing goals. And the goals that we developed are centered around five different categories. The first category we call sustainability. We need to promote sustainable personal health and financial well-being. The second is empowerment, empowering individuals to make informed decisions regarding health needs and the financial implications of longer life expectancies. As you can sort of see, the theme here is we're trying to recognize not only what is happening now, but what we predict in the future. The third is value. We need a system that reduces liability risk and financial and administrative burdens in order to optimize the value and cost effectiveness of sponsoring benefit plans. 4, innovation. And of course, me with my iPad, that's sort of to my sweet spot. Our workforces are global and mobile. We need to be able to foster innovative plan design and funding strategies. Technology is the last, with policy needs to embrace evolving technology to allow information to be transferred among the various stakeholders in the benefit system while, of course, fully protecting privacy. So those are our goals. And then you say those are kind of general. So what do we do now? And what we spent a considerable amount of time with all of our policy board members was to come up with the right section of actual policy provisions, because we didn't want to have this report just be vague and have vague aspirations. We felt that it was very important to get down to brass tacks and to have specific policies that we could actually advocate for, that the ABC staff would be actually have to be able to measure again. So Jim Klein will help us walk through some of the major policy provisions in the report. Thank you very much.
Thanks, Janet, for your chairmanship of our board of directors and your work on this, and thanks to all of you for being here. And let me just pick up, I'm Jim Klein, president of the American Benefits Council, and let me just pick up, if I may, where Janet left off, which is the point that our board of directors felt very, very strongly that this strategic plan needed to be not just a visionary document with the with the vision statements and the goals that Janet described, but also to be very, very practical. We are an advocacy group, after all. So in addition to those 4 vision statements, those 5 goals, the report, as you'll see, contains 46 specific legislative and regulatory recommendations. Now, several of these recommendations clearly support more than one of the 5 goals, but we have listed them in the report beneath the particular goal where we feel it is most naturally aligned, and that's where you'll find it. I want to emphasize that the recommendations are not listed in any particular priority order, and for reasons that we'll be happy to talk about when we get to the questions, we intend to be very, very opportunistic about making progress toward the adoption of these recommendations in the months and years ahead. So the vision and the goals and the recommendations are really not just relevant for purposes of us moving forward on our specific agenda. We know that we don't have a monopoly on good ideas. We're always eager to hear the ideas of other groups, of other elected officials, government officials, and so forth. So the strategic plan will also serve as a benchmark for us to use in evaluating other people's ideas, other groups' ideas, and determining whether or not those ideas help advance or impede our movement toward the achievement of our objectives. Let me take just a few moments to very, very briefly say a few words about 6 of the recommendations that are in the report. 2 are specifically health policy focused, 2 are specifically retirement policy focused, and 2 have general applicability to both health and retirement. So first, let me start with the health. We propose establishing health reimbursement arrangements or similar types of accounts that large employers could use to fund the ability of their employees to purchase health care coverage in the public exchanges. As you probably know, currently under the Affordable Care Act, large employers who are not able to directly purchase coverage for their employees in these public exchanges are not allowed to do this, to provide this kind of funding through an account. Now, of course, these contributions would need to be meaningful enough that they would meet the affordability standards that are set forth in the Affordable Care Act, so that individuals will have the financial wherewithal to then use that money to buy coverage. And we think that this particular proposal is a true win-win-win. It's a win first and foremost for employees because they will have the financial means by which to then go into the exchange and choose the plan that they want. It's a win for the employer because the quid pro quo here is that if the employer does this, then the employer would avoid paying the employer mandate shared responsibility penalty. And we think it's a win for the federal government because clearly, if employers were to step away from the healthcare system, then some of those individuals, some of those employees would go into these exchanges and be eligible for subsidies, which now the federal government would not have to pay. This is clearly not a model that works in every instance, and we don't propose that it is, or that necessarily any of these proposals, would have broad applicability to every single employer situation and worker situation. But it clearly allows employers to move toward this kind of defined contribution approach and offer up more opportunities for their workers. And that one is explained a little bit more fully as recommendation 4E in the report. The second one relates to the so-called Cadillac tax, the 40% excise tax on high-cost plans. Candidly, the American Benefits Council believes, and we've said this for some time, that provision of the Affordable Care Act should be repealed. But in the absence of it being repealed, we think that there clearly are things that Congress could do to mitigate its impact. For example, there could be more realistic indexing of the thresholds to more closely approximate healthcare cost inflation as the years go forward. Such things as the amount of money that employers spend on wellness programs or on-site clinics, activities that are obviously designed to help reduce healthcare costs, should not count against the employer for purposes of whether or not their plan exceeds the threshold and thereby triggers the tax. And thirdly, we propose that there be what what we call an actuarial safe harbor, so that the tax, the so-called Cadillac tax, would be triggered not only if the cost of the plan were above the certain dollar threshold, but if the design of the plan were greater than some value that Congress would establish. It might say you would only trigger the tax if your plan was greater than a so-called gold standard plan or a platinum standard plan. As we all know, the exact same plan can cost different amounts and does cost different amounts in different parts of the country depending on a whole lot of factors, and it doesn't make sense that it should trigger it in one place or another. The real beauty of this approach would be that employers would be able to design their plan in such a manner as to avoid the tax, and that one is described more fully in Recommendation 3C. Switching over to the retirement side, we're very proud of the fact that the council played a large role several years ago in developing and then lobbying for the so-called catch-up contributions to 401k plans, the provision that permits workers over the age of 50 to contribute additional amounts to their retirement savings plans. We believe that this age should now be lowered to age 45. This will further instill a savings mindset and put mid-career workers that much further ahead in saving for their retirement, which frankly, as we all know, with greater longevity is more important than ever. That one is described in Recommendation 2B. A second retirement policy, the fourth one on my list here altogether, is that right now workers under the age of 62 are not permitted to receive distributions from their pension plan and continue working for their same employer on less than a full-time basis. So if they want to work part-time, for example, they need to sort of go through this artificial effort of retiring fully, beginning to collect their pension, and then go down the street and work for another company. It might, in fact, be the competitor of the employer for whom they have worked much of their career. This seems to make no sense whatsoever in a modern, advanced, flexible, mobile workforce. What workers and their employers want to do is be able to stay with their current employer. Many of these employees have very specialized skills and frankly have a smooth transition to retirement and a smooth transition to succession planning. So our proposal would be to change that provision to allow these so-called in-service distributions from a pension for workers who are younger than age 62. Finally, let me just talk about two proposals that have general applicability. We are proposing a completely new paradigm for regulating both retirement and health benefit plans that emphasizes more of an exceptions-based approach to regulating that targets those employer plan sponsors, those service providers who frankly may have a poor performance record, rather than imposing all the burdens and all the responsibilities of all the regulations on everyone within the system. And this approach would have many different components to it, one of which might be that sometimes there would be large employer exceptions to certain rules rather than small business exceptions. Now, we're certainly not intending to, impose any greater burdens or responsibilities on small employers, but the reality is that many times laws and regulations are adopted because of concerns, be they real or perceived, about what might be happening among smaller employers. And then Congress or the agencies follow that up with then exempting those very small employers from those very rules. Our point is that it may make more sense for purposes of meeting the overall policy objectives to sometimes have a large employer exception. And that one is described in Recommendation 3B. Lastly, and Janet referenced this when she talked about innovation and technology, government rules on benefits communication are hopelessly out of step with the realities of how companies and their employees want to both disseminate and receive information. And I hasten to add that this is not the government's fault entirely. It is impossible for any policymaking body to keep pace with evolving technology. Nonetheless, of course, the realities of how plan sponsors must convey information, oftentimes still using paper, simply does not align with the reality of how we communicate today. I mean, just think about it. Between the time that you all last week received notice of this media briefing and today, 10 million iPhone 6s have been sold. And what if that technology or some future technology were able to allow people to receive information in a different way? Shouldn't we have a system that's flexible enough to accommodate that rapid change? We do believe that it is. And so we propose a brand new approach for regulating, for regulatory agencies to adopt a so-called presumption of good faith standard that would allow employers to use technology as it becomes available rather than having to wait for the agencies to catch up and specifically approve that type of technology. And that one is described more fully in Recommendation 5B. So these are just a handful of our proposals. Happy to talk more about them or about any of the other ones in the report. I'm going to call in just a moment here on Mike Kiley from UPS to add some additional perspectives. After Mike, Joe from the Press Club is going to come back up, and we'll open it up for a few questions. And then I would like to call upon somebody who I'm sure you all know, and that's Dallas Salisbury, who is the president and CEO of the Employee Benefit Research Institute. Dallas was somebody who very generously offered his time to the board task force to help us understand some of the emerging trends and thinking about the future as the task force went about developing this strategic plan. And I'll just ask him to come up then and make a few comments relative to how an effort such as this can help plan sponsors and others think about the future. So thanks so much. And Mike Kiley.
Thank you. Tight squeeze here. Good morning, everyone. My name is Michael Kiley, and I'm the Managing Director for UPS's Federal Government Affairs team. I'd like to thank Janet, Jim, the entire American Benefits Council staff, as well as the Policy Board for all the work that they've done to create the 2020 vision for the future of employee benefits. Yeah, it's not easy to bring together all these ideas and put this together as something as meaningful and powerful as what the American Benefits Council has laid out for us today. And they should all be recommended for their work, or commended for their work. I've had the privilege for working at UPS for over 22 years. As a young kid, the Strong Benefits program that the company offered is one of the many reasons I came to work for them. And it's one of the many reasons that I continue to stay here, even in an ever-growing mobile business environment. We have over 400,000 employees worldwide, and 325,000 of those are based in the United States. In the U.S., we provide health coverage to all of our full-time employees and their dependents. And after 12 months, we provide a phenomenal benefit program to all of our part-timers and all of their dependents, which is very unique in today's day and age. All told, we cover about 750,000 lives, in some cases bigger than many states, that we manage or that we sponsor with our partnerships with some of our unions. As the Council's strategic plan points out, the three main stakeholders in the benefits system will continue to be individuals, employers, and the government, each with an important role in crafting and implementing policies that, as Janet has stated, encourage personal health and financial well-being. This is one of the key themes of the Benefits Council's document. All right. As we all know, the Pension Protection Act, the Affordable Care Act are just two examples of the legislation that has changed some of the rules for providing employee benefits. Some of the changes have been popular, while others have not been so popular. But going forward, as was talked about, we have to spend more time and energy on simplifying all of the rules and regulations. Right? As Jim referenced, we need to adopt an exception-based reporting system for much of what we have to report today. The fact is, administering and understanding employee benefits has become too complicated for all three of the main stakeholders. Right now, excessive regulatory administrative burdens are impacting employers' global competitiveness and making it difficult for individuals to make the decisions that are best for themselves and for their families. The fact is, most individuals, most employees don't understand how this all works. Part of that is our responsibility to educate them. Building upon the Council's recommendations that Jim spoke about, the first recommendation that I wanted to talk about is the importance of preserving ERISA preemption. This landmark piece of legislation is celebrating its 40th anniversary this year and has been the cornerstone for providing strong employer-sponsored benefits. Weakening of the ERISA standards, though, are a constant threat by federal, state, and municipal governments. And the more that this happens, the less employers are going to be inclined to want to offer benefits. Let's use UPS as an example. We have employees that live and work in every state, county, and municipality in this country. Imagine if every one of those government organizations implemented their own health rules. The system just would not work. Strong tax policy is essential for a successful employer-sponsored plans, as Janet said. The U.S. needs tax policies that enable employers to fund health and retirement plans and empower individuals to make sound choices for their personal health and financial well-being. Unfortunately, too many people refer to employee benefits as a tax preference, as the report clearly reports. I would say that these are tax essentials. The current law allows for employers to provide health benefits in a cost-effective manner. They incentivize individuals to save for their pensions and retiree health. In the long run, these laws save the federal government money. They don't cost it. Yet only in Washington do we get this backwards. Congress needs to do more to encourage even more contributions, to increase the contribution thresholds that will encourage greater savings. This, in turn, will provide a more stable future for all three of the stakeholders. As we talked about earlier, all three stakeholders play an important role. As the vision points out, a vitally important role of the government is to ensure the stability of Social Security, Medicare, and other public programs. A strong employer-sponsored system can help relieve these pressures on these systems, but they will all fail without the solvency of the main federal programs. One of the main themes of the vision is that plan sponsors must innovate and change in order to be sustainable. At the cornerstones of these efforts, UPS is dedicated to educating our employees about their health and retirement options. At the same time, we are making many of the difficult decisions a company has to do that we ultimately believe will help improve our employees' health and improve outcomes. Last year, we introduced a significant tobacco surcharge to all of our health plans, along with a tobacco cessation program. All told, this drove change. Over 3,000 employees have gone through the program. They have completed the tobacco cessation. They've decreased their risk of significant health issues, and at the same time are reducing their health premiums. Greater quality and price transparency will also improve our health delivery system and drive down costs. The more transparent the health system is, the more empowered our employees can be to make informed decisions when shopping for health care. We are working with our vendors to make the information readily available to our employees, but we are not where we need to be in an economy that is driven by technology. Another vision that the Council has laid out is the need for greater coordination between Congress, the administration, and across government agencies. Our plans are complex and fall under the jurisdiction of different congressional committees and regulatory agencies. The United States government needs to take a holistic approach in the way the health system is delivered and eliminate as many administrative and regulatory burdens as possible and leverage efficiencies. One simple example is that employers should be given the option of communicating to our employees and the federal government electronically for 100% of our reporting and communications requirements. In several cases, we are mandated by law to send documents home in the mail to a millennial generation that doesn't even know where the post office is or their own post box is. As the Council has clearly laid out, in order to have a truly world-class employee benefits delivery system that is globally competitive, the United States must tackle deficiencies in several areas. The 46 recommendations have been sectioned off into sustainability, empowerment, value, innovation, and technology, and they all must be addressed and cannot be looked at in a vacuum. All the reform ideas that are being shared with you today are inextricably linked and must be addressed in a thoughtful, and I will stress this, a nonpartisan manner. Thank you for your time, and I'll hand it back.
Do you want Steve? Okay. We will open it up for questions in just a minute. One note I forgot to mention earlier is Allison Klausner was scheduled to be here but was unable to make it. So what I would like to do for questions, to give these people an opportunity to speak, I will point out who gets the question, but I'm going to remove myself from the microphone so that the appropriate speaker can come up and ask the questions. When you speak, please introduce yourself by stating your name and the organization that you work for or are affiliated with. Okay, questions.
Hi, I'm Ted Knudsen. I'm a reporter for Financial Advisor magazine. One of the goals that you list here, and certainly on the surface it makes sense, is integrating personal health and financial well-being. How do you do this? What are the details? And also, too, one thing, the only detail I see in here, and please expand on it, it says provide access to information on Social Security and Medicare on an integrated basis. How would that actually be done, and what other steps should be done to integrate health and financial well-being?
I think to the extent possible, we'll try to answer the questions from up here for everybody's sound purposes and the camera up there. I think that the idea about the integration of health and retirement is more than sort of the concept of moving forward and not thinking of these as entirely separate, but recognizing also that the resources that are devoted to some types of benefits, can have a direct bearing, obviously, on the resources that are available for other kinds. I think that for some employers too, as you sort of gathered from some of the remarks here, some of the proposals allow the adoption of a different approach, a more defined contribution approach on the healthcare side, as we've seen an evolution on the retirement side. But then there are other specific proposals in here that go sort of directly to the integration of the two. For example, allowing monies that may be in 401k plan accounts to come out of those accounts on a more tax-favored basis if that money is used directly for the provision of purchase of healthcare services or the purchase of healthcare coverage. So the idea of enabling individuals to look at this sort of pot of money in a more integrated way, as well as, of course, their employers. In terms of the Social Security Medicare question, we didn't provide a lot of detail around that. It's just that what that one was responding to was concerns that we've heard that the way in which you can access that information from those websites and so forth is not exactly the same, and we just wanted to have something that would help move them and clarify, have the agencies, if you will, the federal government, do a better job making that a little bit more user-friendly. And by the way, as Joe did mention, we're joined here by a couple of my colleagues, Lynn Dudley, who's our Senior Vice President for Global Retirement and Compensation, Katie Spangler, our Senior Vice President for Healthcare Policy, who can chime in, or I might direct some questions their way. In the back are our sort of two in-house attorneys, Jan Jacobson, Senior Counsel on Retirement, and Catherine Wilbur, Senior Counsel on Health Policy. And Catherine in particular spent a great deal of time on this project before Katie joined us earlier this spring.
Hi, I'm Roshana Pradhan. I write for Inside Health Policy. I had a question about the HRAs and establishing those accounts. So I know you all, I think, and other businesses have talked about how it's important to preserve the employer-sponsored insurance system, but allowing you all to have those accounts and then help your employees purchase plans on the exchanges, isn't that going against that whole idea?
The short answer to the question, I'll repeat the question for the benefit of the recording. Oh, you got that? Okay. The short answer to the question, I think, is no, we don't feel that way. First of all, we went to great lengths to express the fact that this approach won't be for everybody. But the reality of it is that we think that allowing for these kinds of accounts that employers would fund will actually keep employers engaged some of whom might otherwise choose to exit the system altogether. So we would much rather have a situation where an employer is encouraged to remain involved, to put a meaningful amount of money into these accounts so that their employees will have the financial ability to then purchase coverage. So we view it exactly the opposite, as a way of keeping employers engaged, not separating them.
I could add somewhat of a practical viewpoint on that from a Dow perspective. One of the areas that we've been looking at is whether or not this might be a feasible way to manage our retiree obligations. In that case, you don't have an active employee, but you have an obligation and, a relationship with your retirees that remains important, so you don't want to cut them off. But with the growth of the exchanges, it's probably going to be cheaper for our retirees to have access to the flexibility on the exchanges of the different kind of plans than to remain on our kind of narrow single area plan. So what we're thinking of is, as the exchanges become more established, and assuming that they do become more established, that we are going to be probably starting to look at this as maybe being a better solution for our retirees than what we currently have.
Actually, well, I'd like to ask a follow-up question on healthcare. So one of the issues, if you look with the exchanges, is that more and more healthcare costs have been shifted to the employee, and that's a concern. And particularly now with a lot of plans on the exchanges, they have high deductibles, which shifts even more costs to the employees. So one of the issues, as healthcare costs keep rising faster than income, it'll become more and more expensive. So I'd like to know how the ABC would address the increasing burden of healthcare costs that are burdening employees.
I'm going to ask my colleague Katie Spangler, our Senior VP for Health Policy, to come forward.
Thank you, Joe, for the question. So a few things that we mention in the report. A couple are pertaining to price transparency and quality transparency, and increasing some of the data that's available through the Medicare program, so you can have a more appropriate apples-to-apples comparison when employees are looking for services from either hospitals or physicians. And they can, before they go in to get a service, they could possibly price that, learn more about which physicians score in which regard for different surgeries or which hospitals. So those would be recommendations 2D as well as 2E on both the Medicare side as well as the price transparency side through employers. In addition, we've also looked directly to your question of plans on the exchanges, sort of in the trend toward a higher deductible plan. And we've seen data that says that more and more employers are looking to move to high deductible plans. A part of that is to get out from under or to avoid incurring the Cadillac tax. So one thing, in addition to working with Congress and the administration to lessen the impact or ideally repeal the Cadillac tax or the excise tax on high-cost plans, would also be to work as folks do move to high deductible plans, either because they're concerned about incurring the Cadillac tax or just because that's what's right for their company. We could look to achieve a little bit more flexibility for those high deductible plans that are coupled with health savings accounts. Specifically, right now, there is a safe harbor written into the Internal Revenue Code for preventive services. Currently, IRS defines prevention very narrowly. So one example would be to change the definition of prevention or create an additional safe harbor so employers would have the option to offer more high-value services before an employee has met their deductible.
Sure. Stay up for a minute. Does everybody know what the Cadillac tax is? Why don't you just briefly explain that, please?
Sure. So the excise tax on high-cost plans was incorporated into the healthcare law for two reasons. One reason was to, quote, bend the trend or put downward pressure on healthcare costs by creating this tax on high-cost plans. The idea is that employers would offer less rich benefits, which we are starting to see changes, and folks have started to change their plans to offer benefit packages that would ideally not incur the tax. And the second reason for implementing the Cadillac tax was to create a revenue source to pay for other provisions of the healthcare law. So those were kind of the two reasons for implementing the tax. It goes into effect for tax years after December 31st, 2017. The council has recently issued a brief mentioning the Cadillac tax and sort of describing it and frequent question and answers. So if folks have more questions on the Cadillac tax, happy to chat offline.
I'm Jim Landers of the Dallas Morning News. I wanted to go a little further with this. I mean, there's nothing I see in the plan for benefits that gives employers any voice in trying to leverage down the cost of health care. You're giving employees quite a bit more responsibility for doing that with higher deductibles. You're talking about defined contribution plans for health care, which would essentially charge them to go out and shop not only for hospitals and doctors, but insurance. Why don't you have something like, Leapfrog, which employers started, to look at price instead of, saying, well, we'll go out there and look at what Medicare is publishing now about charge masters, which are totally unrealistic prices, or see what you can find out from your doctor about the cost of care at this place or that place. I mean, it doesn't seem like the employers are taking the battle at all. They're just handing it down to their employees.
So it's a great question, and it was subject of an intense discussion within the council. I would encourage you to look closely at recommendations 2D, as in David, and 2E. The 2D does get at your question of right now there is a lot of Medicare data that's available. Perhaps it could be more useful to employers as they work directly with their third-party administrators. In addition to E on price transparency was a big discussion. The idea if a patient needs a mammogram or a colonoscopy, they have no idea what that's going to cost before they go in for the service. And a lot of times, as there was a great article this weekend detailing how difficult it is to know if you're an employer, kind of how to contract with a hospital or a physician, and the fact that while you might have in-network providers, sometimes things happen in the course of a procedure. So again, we nod to those problems. I think they are very real problems. I would yield if my colleagues have anything they want to add on these points, but you bring up a very good question. We do nod to both of those things in the two recommendations that I mentioned.
I guess I would just add there are several others. If you look to the ones that relate to promoting more in terms of health wellness programs, the proposals that relate to limiting the scope of state innovation waivers that we think could lead to additional healthcare costs. We're very concerned about COBRA. This is an issue, frankly, that's been talked about since before the Affordable Care Act was enacted, which is, in a world where exchanges occur, exchanges exist, and individuals cannot be denied coverage for pre-existing conditions, why not have a scenario whereby individuals would be able to sort of after the completion of the plan year in which they become separated from service or whatever, be able, rather than having to pay 102% of their prior employers, what might have been a gold plan or platinum plan, have access to the exchanges where they might choose a bronze plan or a silver plan and depending on their circumstances, might, in addition to that, be eligible for a subsidy to help them afford it. So, employers would have the ability, obviously, to keep people on, but also open up this opportunity for them not to do that, and to encourage people to find other ways that aren't going to be just better for the employers, but better for the employees as well. I think you had a hand up in the back there.
Hazel Bradford with Pensions and Investments. I wanted to pick up on something that you had said about an exceptions-based approach as opposed to everybody has to do it unless you. How are you going to get there from where we are now in both regulation and legislation? Or should we even talk about Congress doing anything?
I think we always have to try to put pressure on Congress and the administration to make these changes. When you talk about doing full reporting on 750,000 lives, when in some cases, say with UPS, where we have the vast majority of our employees and dependents in multi-employer health plans, we don't even have the data. The data is held by a multi-employer plan, and we somehow have to get it from them, but they don't have to give it to us. So it is constant pressure on the regulatory bodies that some of the things that they're asking us to do in some cases aren't even physically possible. Now, we're going to get it done, but it doesn't have to be this difficult. We can prove that we are providing more than the minimum required benefits to every single one of our employees. We have a staff of IRS agents that live in our corporate headquarters. They can go audit these things without having to spend a tremendous amount of time. So it's constant pressure, it's constant education, and hopefully we can get there, but we can't stop making sure people understand how these laws actually work and impact employers and employees.
What are you talking to Congress or regulators now about changing?
Do you want to hit that, Jen?
I'm sorry.
What's in discussion now? What are you trying to change now, both either on the Hill or among the regulators?
Well, I mean, one example is, and I don't want to say we're doing it now, this is obviously the report's coming out today. And as I said, this particular approach will have different components to it, that notion of large business exceptions being sort of one element of it. But I would just point out, and then I want to turn it to my colleague Lynn Dudley to embellish further, that in the early years after ERISA was passed, the regulatory framework for determining whether or not retirement plans were non-discriminatory was based on a more flexible, what was called facts and circumstances type of a standard. And then that all changed in the Tax Reform Act of 1986. So for nearly 30 years now, we've had this highly mechanized, exact approach that employers, plan sponsors have had to follow to prove that their plans are non-discriminatory. And we think that a system that, it sort of focuses on those who might be actually abusing the system and going after them, and maybe those entities accepting the reality of even potentially harsher penalties for those abuses is a far better, more logical approach than one that has this overlay of complexity on everyone, when everyone really acknowledges that the vast majority of players in the system are doing so in a responsible way. Lynn, do you want to add anything further?
Sure. Your question is a really good one. And one of the things that we are trying to do now is to try to get Congress, when they do take action and they do pass something, to give greater direction. This solves a couple of problems. It solves the problem of what do plans and plan sponsors do between the time the law is passed and guidance is issued, and so that they don't end up having to comply with the statute only to find out the regulations interpret the statute differently than they all thought. And so that's something that's a really important piece of this. But as they give more direction, they also can set it up so that it's more exception-based driven. And this is really important not only in existing laws as we try to go back and try to fix some things, but one of our visions really looks to the globe and looks to the world. And our companies are operating more globally than they ever have before, and making our rules very simple and easy to understand
and to make them exception-based has a real tremendous value as we are interacting with other countries and rules in other countries, and companies may be headquartered in other places, and they're trying to grapple with our laws. So we're really trying to look at this very holistically and very universally.
Joe, could I ask at this point, Dallas Salisbury, to come forward?
Yes.
Right. So I have one last question, and that's on the exception. That's on the exception-based proposal. Can you give me a hypothetical / concrete example of how that would work? So we have the Ajax company, which has 500,000 employees. It's a large, very large company, and so we would get the exception-based proposal. It would get that kind of rule. How does that work?
Well, obviously, this would have to be developed. So what we're calling for here is sort of the basic framework of it. But as an example, I mean, I think the idea embraces the notion of a greater degree of trust between the regulators and those who are regulated. From the regulators' perspective, they need to have some greater trust that employer, plan sponsors, service providers are operating the plans within the framework of the public policy that is enunciated by Congress and the agencies. From our perspective, we in the regulated community need to have a greater trust that the regulators are then applying the rules in a way that is not arbitrary and that is consistent. So it really goes more not to necessarily that the rules themselves would change. It really goes more to the manner in which it would be enforced, and with this sort of greater flexibility, the facts and circumstances kind of example that I gave for non-discrimination rules would be a specific example, but it also relates to just the relationship between the two that we think will allow for a greater flexibility on the part of those who are operating sponsoring plans and a willingness to accept the fact that the regulators have a legitimate claim to go after those who are abusing the system.
I should have announced who that was. That was Sean Forbes for Bloomberg BNA.
Thank you, Sean. If I could just ask somebody who truly needs no introduction for those familiar with employee benefits, and that's Dallas Salisbury, who's the president and CEO of the Employee Benefit Research Institute. EBRI is not an advocacy group like we are, but Dallas has obviously a great vision around these kinds of topics, and welcome his presence here.
If I may, for those people who aren't familiar, his institute, they are strictly research. They do not get into policy or advocacy. They're just trying to help people understand the issues. And I think that's an important point to realize.
Good morning. I'll be brief. Jim, thanks for calling me yesterday. I actually had RSVP'd to come and just listen. And Jim was kind enough to call and say, would you comment on a couple of the trend issues and the context that you tried to create for the task group. And it just is to underline 4 things. One is this issue of choice, flexibility, the question related to high deductible plans and all. And it really goes back to a point I made to them, which is that mobility figures in the economy as one moves out of the largest public and private employers, that median job tenure since 1952 has been right around 4 years. So we have always been a highly mobile society, and if one is looking at the provision of health and wellness, financial wellness programs to the broad population, they need to be designed and will have to be designed in cognition of the level of turnover that has always been there. Even in the most stable seat of employment, which has traditionally been state and federal government, the high point for those who spent full careers with the federal government, meaning 25 years or more, was 24% that ended up with pensions out of the federal government that were full formula, so to speak. And that in the private sector right now runs about 7.5%. So flexibility and the flexibility in these programs actually began in the federal government with passage of the Revenue Act of 1978 that created something called Section 125, which led to the notion of cafeteria and flexible benefit programs that would meld together all health, all disability, all life, and multiple other programs. The first of those plans, TRW, that came into being in 1979, had 11 different benefit programs that were part of that platform. Then the federal government led the way, if you will, in 1984, when it shifted from the civil service retirement system, a no Social Security coverage, defined benefit formula, longer vesting periods, and it basically took all new workers beginning on January 1, 1987, and moved them into the federal FER's program, which is a 1.1% defined benefit versus the old 2.4% benefit, and then introduced a very generous defined contribution program and brought people into Social Security, essentially recognizing that all of these programs need to fit together. And it was really only after the federal government changed the rules for federal employees that employers in the private sector started doing some of those same things, and some of the trends developed. And to the brief question on the issue of moving to high deductible plans, I stress that really again started with the federal government. It came out of the Ways and Means Committee and Chairman Archer in Texas, which created an emphasis. It was greatly reinforced by the Affordable Care Act. And when one looks at the rules vis-a-vis exchanges and all, there's actually a very heavy federal government push through ACA to move employers and employees, I guess I'd say like it or not, in that direction. Thirdly, the public policy and income levels, this marriage of different things, the flexibility theme, is just to underline that notion that the federal government moved to in 1984 and earlier in 1978. And it's just the tremendous diversity of the population, the focus on design of these programs to meet various and sundry life stages, and the tremendous differences across income levels and number of hours worked of the population in terms of those needs. If you underline today, about 37% get only Social Security in retirement. Of those working today who will retire in the next 20 years, the current estimate is that 37% of them will have only one income source in retirement, Social Security. Not because they don't have opportunities in many cases. Any worker in America has the opportunity for a tax-deferred individual retirement account. Most have the ability to have a deduction into that. But as a pure economic matter, if we look at the debates over minimum wages, we look at the debates over means-tested benefits, the broad-based reality of the economy is these needs for tremendous flexibility. And a concluding point vis-a-vis something that came into the futurist literature and we focused on as early as 1982 in our meetings was the growing movement and trend among futurists and demographers that underlines the technology point that is a focus of this report. And that was the notion most readily popularized by in the Carter administration by one of the first publications on future labor force, and then by an author in Megatrends, John Naismith, in the early 1980s, which was this notion of the necessity of individuals facing multiple careers. Not that they didn't always have multiple careers when one looks at job change and tenure, but with a fundamental change. That fundamental change being the need for dramatic re-education, retooling, and retraining at various of those stages, whether amongst employers, across employers, or with one employer. And last evening, I happened to be listening to the Pennsylvania gubernatorial debate, and both candidates agreed that the education issue was a challenge in re-education. As they noted, in spite of a sticky unemployment rate, 200,000 jobs were still going wanting for absence of individuals with the technology and technical skills to fill those jobs. So that just underlines the trends and the needs for flexibility that are in the document. And those were some of the types of things that we tried to emphasize. We did not get into discussions with them, per the advocacy point, with any of their policy recommendations.
Well, I think we could stay here all afternoon and not understand all the issues. But going forward, obviously, this is important both to businesses and employers, and as they said, the government. I would like to thank all our speakers, and this concludes the event. Thank you for attending.